In this video, I'm going to talk briefly about depression. In Sinhalese, we call it avapathya. So, what happens when somebody is depressed? What are the symptoms? What might that patient be complaining of? There's a triad of symptoms, three of them. One is loss of interest in everything that you do. Then, increased fatigability and loss of energy and low mood. That's the triad. Now, if somebody is severely depressed, then that person might have all three of them. Otherwise, he might have two. It is also important that this patient has suffered these symptoms for a longer period than 2 weeks, 14 days. Now, what can be the other symptoms of feeling depressed? One might be waking up quite early in the morning, and one's sleep might be disturbed at night too. Then there can be loss of appetite, there can be loss of weight. The person might feel suicidal. In certain cases, person also might feel anxious. The person sometimes, if the depression is severe, might also harbor what we call the psychotic symptoms. The psychotic symptoms that you find in depression are called sometimes nihilistic delusions. In other words, the patient feels that he doesn't have anything. Maybe he doesn't have money, maybe he doesn't have clothes to wear, maybe he doesn't have his internal organs, and so on. Now, it is important for a doctor to interview the patient and find out if these symptoms have lasted for longer than 14 days. And if so, when the diagnosis of depression has been made, the doctor can start treating this patient. Now, treatment is something we will discuss in another video. Depression actually is a common problem. There are a lot of morbidity, there are a lot of suffering in this world due to depression. Not only for the patient, but also for the family and for the society. There are certain disadvantages and problems when somebody is suffering from depression. So let's try to identify it. If somebody is suspicious that one might be depressed, it's important that that person seeks medical advice.